Fever. It's a word that can strike fear into the hearts of parents everywhere. But what exactly is a fever, and why does it happen? Simply put, a fever is a temporary increase in your child's body temperature above what is considered normal. This rise in temperature is a natural response, a signal from the body that it is working hard to fight off something harmful. It's important to remember that fever itself is not the illness. It is a symptom. Think of it as a flashing red light on your car's dashboard. It alerts you to a potential problem that needs attention. The normal body temperature for most children is around 98.6 degrees Fahrenheit or 37 degrees Celsius. A fever is generally considered to be present when a child's temperature reaches 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. While a fever can be uncomfortable for your child, it's often a sign that their immune system is working properly. Just like a well-trained army mobilizing to defend against an invasion, a fever helps the body fight off infections. Now that we understand fever is a symptom, let's explore some of the most common reasons why children develop fevers. In children, the vast majority of fevers are caused by infections, which can be caused by viruses or bacteria. Viral infections are the most frequent culprits of fever in children. These include common childhood illnesses such as the common cold, flu, ear infections, and stomach viruses. Viruses are microscopic invaders that can spread easily from person to person, especially in close quarters like daycare centers and schools. Bacterial infections, while less common than viral infections, can also cause fever in children. These infections occur when harmful bacteria enter the body and multiply, leading to illnesses such as strep throat, urinary tract infections, and pneumonia. Other factors can also contribute to a rise in body temperature, immunizations, and overdressing. Remember, this is not an exhaustive list. If you are concerned about your child's fever or its underlying cause, it's always best to consult with their pediatrician. It might seem counterintuitive, but fever, while uncomfortable, plays a vital role in helping your child's body fight off infections. Think of it as a natural defense mechanism, a way for the body to create an inhospitable environment for invading germs. One way fever fights infection is by boosting the immune system. When your child's body detects an infection, it releases chemicals called pyrogens that travel to the brain, signaling it to raise the body's thermostat. This increase in temperature helps to activate and mobilize the immune cells responsible for fighting off the infection. Fever also helps to slow down the growth of germs. Many bacteria and viruses thrive at normal body temperature. By raising the temperature, fever creates an environment that is less hospitable for these invaders, making it harder for them to replicate and spread. While fever can be an effective tool in fighting infections, it's crucial to monitor your child closely and ensure they are comfortable. Section 4. Fever in children. When to seek help. As a parent, it's natural to be concerned when your child has a fever. While most fevers are harmless and resolve on their own, there are times when it's important to seek medical attention. For infants under 3 months of age, any fever should be taken seriously. Contact your pediatrician immediately if your infant has a rectal temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher. For older infants and children, the height of the fever is not always the best indicator of the severity of the illness. Pay close attention to your child's overall behavior and symptoms. Contact your pediatrician if your child's fever is accompanied by any severe symptoms or lasts longer than 3 days. Section 5. Navigating fever at home. Practical tips for parents. When your child has a fever, it's natural to want to do everything you can to make them feel better. While it's essential to address the underlying cause of the fever, there are several things you can do at home to help manage your child's discomfort and support their recovery. Medications. Over-the-counter fever-reducing medications, such as acetaminophen or ibuprofen, can help lower your child's temperature and alleviate discomfort. Always follow the dosage instructions on the label and consult with your pediatrician before giving any medication to your child, especially infants. Hydration fever can lead to dehydration, so it's crucial to ensure your child is drinking plenty of fluids. Offer them water, clear broth, or electrolyte solutions like Pedialyte. Rest. Encourage your child to rest as much as possible. Comfortable clothing. Dress your child in light, breathable clothing. Cool compress. Applying a cool compress to your child's forehead or giving them a lukewarm bath can help lower their body temperature and provide some relief. Remember, these home care measures are meant to manage your child's comfort while their body fights off the infection. Section 6. Debunking fever myths, separating fact from fiction. Fever is often misunderstood, leading to a number of myths and misconceptions. Let's debunk some of the most common myths about fever. Myth: all fevers are dangerous and need to be treated immediately. Fact: most fevers are harmless and a sign that the body is fighting infection. Treatment is not always necessary, especially if the fever is mild and the child is otherwise well. Myth: fever will cause brain damage. Fact: fevers rarely cause brain damage. Brain damage from fever typically only occurs at extremely high temperatures, above 107 degrees Fahrenheit or 41.6 degrees Celsius, which are rare. Myth: feeding a fever will make it worse. Fact: it's important to keep your child hydrated and nourished when they have a fever. Offer them small, frequent meals and snacks that they can tolerate. Myth: if you have a fever, you must have the flu. Section 7. A Parent's Guide. When in doubt, seek expert advice. Navigating the world of childhood illnesses can be daunting for any parent. Fever, while a common occurrence, often raises concerns and anxieties. Understanding what fever is, its role in the body's defense system, and when to seek medical attention is crucial for every parent. Remember, fever is not the enemy. It's a sign that your child's body is working hard to combat an infection. While most fevers are harmless and resolve on their own, it's vital to monitor your child closely and seek medical attention if you notice any warning signs. Your pediatrician is your trusted partner in your child's health journey.